Welcome to URI College of Pharmacy's virtual presentation of motivational interviewing, culturally appropriate communication strategies for the integrated behavioral health team. Today's webinar is the third in our 3-module series, Telehealth Beyond the Basics, Culturally Appropriate Healthcare. And we'll build upon some of the things that we talked about in the first 2 webinars: best practices, strategies, and tools for adapting behavioral health services to telehealth in a culturally appropriate manner. So this webinar will provide guidance on utilizing motivational interviewing principles via telehealth, and with the goal of engagement and facilitating change. For those of you who didn't meet me in the first couple of webinars, I'm MJ Canisett. I'm the Director of Continuing Education here at URI in the College of Pharmacy, and joining me is Brenda Norris. And on behalf of the Office of Continuing Professional Development, it's our pleasure to virtually welcome you all, and thank you for taking your valuable time to invest in your own professional development. We look forward to your engagement today, and especially to your feedback after the program. Before we get started, as Nellie said, I have just a couple of quick announcements, and I certainly would like to express my appreciation to those who made the program possible today. First is the Executive Office of Health and Human Services in Rhode Island, who provided the funding for the modules. I'd like to thank Bill Stein, our speaker for today, for sharing his time and expertise with us. And certainly, last but not least, to Dr. Burdett, whose collaborative efforts and insight helped to identify this training need. So thank you all. Today's program is accredited for nurses, licensed mental health counselors, and social workers for 1 hour. And CEUs for physicians will be available. And finally, Bill has no actual or potential conflict of interest in relation to this program or today's presentation. And last but not least, we just hope that you'll stay connected with us to learn about future educational activities. Obviously, being based here in the College of Pharmacy, we do a lot of pharmacology, medication management, treatment updates, and are constantly refreshing our educational offerings. So hope to see you again. Well, it's my pleasure to introduce our speaker for today. I think many of you know him. He's done some trainings with you all, I know, and you're familiar with his experience and dedication to training, certainly. Bill Stein has nearly 20 years of experience in human services, including 13 with House of Hope Community Development Corporation. Bill earned his BA in sociology from the University of Rhode Island and a Master of Social Work from Rhode Island College. And he's also a licensed independent clinical social worker. He's developed curricula and facilitated trainings for homeless service providers on the topics of trauma-informed care, motivational interviewing, and critical time intervention, and operates the Peer Mentor Employment and Training Program for House of Hope. He's a senior level certified instructor through the Crisis Prevention Institute in Nonviolence Crisis Prevention, and is also a certified instructor in mental health first aid. Welcome, Bill, and thank you for being with us today.
Thank you for the introduction, much appreciated. And I do know that there are, as I was watching the chat, a lot of names that I recognize, so it's good to see everyone again. Without any further ado, I think we will jump into the training today. And I'm going to share my screen really quick and pull up PowerPoint. So today we're going to talk about motivational interviewing, which is a clinical technique that is near and dear to me, and talk about how to apply some of the more advanced techniques to telehealth strategies, and also talk about the intersection of healthcare and motivational interviewing, which I think is a very important kind of promising practice. I like motivational interviewing a lot. I think it works in all of these non-traditional settings. I've done it on napkins at Friendly's, the readiness ruler and the four-way window that we're going to talk about. I've done on napkins. Our street-based outreach workers use motivational interviewing all the time. It's something that does exceptionally well outside of traditional settings. And when I say traditional settings, I mean traditional clinical therapeutic settings. And I think that we can start looking at healthcare as one of those perfect non-traditional environments where motivational interviewing can be so effective. And so hopefully be able to help everyone kind of see some application for MI in their work. Just revisiting the disclosure statement, I have no relevant financial relationship to declare, and we will get started. All right, so some of the things that we're going to talk about today. We're going to learn how to assist clients in eliciting their own motivation for change. I want to really emphasize the evoking process of motivational interviewing. We're going to do a quick review of the four processes, but evoking is the one that we're really going to dial into today. Going to learn how to apply the motivation ruler and the four-way window tool in traditional and non-traditional settings, and think about identifying presenting problems, change state, motivation to change, and then eliciting that change talk through some participant role plays, which we'll get to at the end. So a quick knowledge check just to see where folks are. I have two pre-test questions that we've put together. And MJ, can you cue the polls? Perfect, thank you. So the first question, which of these is not one of the four processes of motivational interviewing? Engaging, focusing, explaining, or planning? I'll give you all a minute or two to select your responses. All right, shall we move on to the second poll, which is not one of the key components of the change process: readiness, ambivalence, importance, or confidence? So how did everyone do on those? What do we get from responses? So I saw that in the first poll, the most prevalent answer for the question about which is not one of the four processes of motivational interviewing was explaining, which is the correct answer. The answer, the fourth processes of motivational interviewing is evoking or being evocative. We generally want to avoid explaining, so that was the correct answer. The poll number 2 was a little bit of a trick question because many of you have heard about the importance of ambivalence to motivational interviewing. But ambivalence is not one of the key components of the change process. Ambivalence is something that we want to work to decrease so that we can enhance people's readiness, importance, and confidence. So all of you that chose ambivalence, that was the correct answer. So nice job. All right, just a very quick review. We're going to spend about 10 minutes covering some basic components of MI. First of all, motivational interviewing is non-judgmental, empathic, reflective, patient-generated change talk. And The most important thing with motivational interviewing is that we are creating that helping relationship that is centered on the person and their own motivation and commitment to change. Ultimately, our goal is to take a bit of a backseat in motivational interviewing and really allow the patient to be the expert on the change process and to let them kind of determine what that change process is going to look like. I think there are a lot of interventions where we as providers are a little bit more in the driver's seat, where we do a lot more telling, a lot more showing. But in motivational interviewing, the idea is to sit back and to let the patient kind of make those decisions, make those determinations to truly be the expert on their own lives, what's worked for them, what isn't, what hasn't worked, what will work in the future, and what won't work in the future. If we can key in on those things, we will be successful in motivational interviewing. So traditional applications for motivational interviewing. Typically, it is most useful for people who are reluctant or ambivalent about change. When people are on the fence and they don't know whether they should change or not change, that is where motivational interviewing is most useful. And we're going to talk about some strategies that you can use to enhance that change process or decrease that ambivalence about change. It's particularly useful for individuals with substance abuse issues. This is really where MI started. But over the years, it's been applied to a variety of other issues such as gambling addictions, weight loss, health improvement, or and really any type of harm reduction is a great place to think about using motivational interviewing, to think about enhancing the change process for folks. So a couple key concepts in motivational interviewing. We want to focus on PACE. So partnership, acceptance, compassion, and evocation. As I mentioned before, we want to make sure that the individual is the expert in their lives and in the change process, so that partnership is really critical in engaging with a person, with a patient, and helping them move forward through the change process. We also want to accept that person for who they are and where they're coming from. We want to accept their expertise. And most importantly, if someone is telling us that something isn't going to work, we need to accept that as well. Because if someone's telling you that something isn't going to work, they're already kind of setting something that's already setting them up for failure. And so rather than thinking about what won't work or forcing people to do something that they don't think will work, we want to focus on what they think is going to work. And acceptance is how we do that. Compassion is very important in MI. We need to be compassionate. We need to be caring. We need to acknowledge the inherent dignity and worth in the people that we're working with, because that's how we can be better partners. That's how we can be accepting of some hard answers that we don't want to hear or things that maybe we disagree with. And the last component in the spirit of MI is evocation. And this is one of the most critical components, and it's one that I'm going to spend a lot of time talking about today. It is really about evoking feelings within that person to get them to change or to get them to move forward with the change process. When we tell people that change is important, they may hear us, but when we get them to find those reasons in themselves, that's when they truly move forward in the change process. And that's when they sustain change. When we tell someone that they need to change, they need to be healthier, have better eating habits, those type people hear those things and it matters for a little while, but it generally doesn't sustain change over time. Whereas for them finding those reasons inside themselves, that's where we get to moving forward and sustaining change and making that lifelong progress that we're hoping to help people with. So a couple other things that we want to really think about when it comes to MI. We want to make sure that we are giving people autonomy. in the decision-making process, in the choice process, and in the change process, as opposed to focusing on our own authority as practitioners. Our goal here is to make the folks we're working with the true experts in that change process. We want to collaborate with folks, working together with them as a team, as opposed to confronting them on behaviors. And we, as I mentioned before, we want to make sure that we are generating change talk that's evocative versus us explaining to people why they should change. Explaining works in a lot of settings. It doesn't work as well in motivational interviewing. When we focus on explaining, when we focus on confrontation or focus on authority, that builds resistance. And anytime we're building resistance, we are not engaging in motivational interviewing. There's a saying in the MI world that resistance is not a patient problem, it's a provider problem. If we are generating resistance through authority, confrontation, or explaining, we need to back off a little bit, and it's really our responsibility as providers to change that tact and to find a method that is going to work for the person that we're working with. Hence the really person-centered piece of motivational interviewing. So three key components of motivational interviewing: readiness, importance, and confidence. We spend a lot of time talking with folks about the second of these components, the importance. How willing are they to change? And I agree that importance is important, right? We got to make sure that people have a reason to change. But when we only focus on importance and don't think about the other two components, we miss opportunities to really strengthen and sustain that change process. So readiness, right? How ready does a person think they are to change? Is this the right time in their life for them to change? Are there external stressors that are going to make that change process very difficult? How about confidence? How able do people think that they are to change? Because you can know that a change is really important, but if you don't feel confident in your ability to execute that change or sustain that change, it's less likely to happen. And when I find people that get stuck somewhere along the lines of the change process, whether they get stuck in the pre-contemplation phase, the contemplation phase, the determination phase, the action phase, the maintenance phase, any one of the stages of change. When I see people that are getting stuck, it's usually because one of these three components is in very good shape, but one or two of the other components aren't as fully developed. And so one of the really key pieces of taking your motivational interviewing skills to the next level is looking at these three components as a whole. And really, I almost like to, picture this as a stool or a table, a three-legged table. If all three of these lengths aren't strong, people aren't going to be steady and people aren't going to be able to sustain that change. So really, really, really important that we think about all three of these components. I want to talk a little bit more about how we can build those three components a little bit later. How many people recognize this, the readiness ruler? All right, I can't see any hands here, so there we go. I see some thumbs up. Excellent. All right, so the readiness ruler is one of these really basic things that we do in motivational interviewing that works in a lot of ways. But one of the weaknesses of the traditional application of the readiness ruler is that we only focus on one of the three components of motivation when we're doing this. So I will see a lot of people break out the readiness ruler and say, okay, on a scale of 1 to 10, how important is it for you to make that change? And people are like, it's an 8, it's a 9, it's a 10, it's really important. And people still aren't sustaining that change because they're not applying the readiness ruler to those other two components of MI. And so one of the things that we're going to do when we role play a little bit later is work on applying the readiness ruler to all three of those components of motivation, not just one. really critical skill in bringing your MI technique to the next level. So we will hold off on that for a little bit, but just know we're going to talk about a very advanced form of the readiness ruler in a little bit of time. One last review slide, 4 processes of motivational interviewing: engaging, focusing, evoking, and planning. Engaging, focusing, and planning are things that matter to motivational interviewing, but to me, they're not the key concept of motivational interviewing. For me, MI is all about evoking. It's about that preparation for change or generating change talk. And we're going to spend a lot of time diving into this process of motivational interviewing during our training today. All right, so now I want to spend a little bit of time talking about how we can apply motivational interviewing to non-traditional settings, including to healthcare settings. So this is a good time to throw any questions you've had so far into the chat. And more importantly, if you have questions about how you might apply motivational interviewing to your specific setting in a telehealth field or in the healthcare field, this would be a really good time to get those questions in there, and I can start preparing for kind of responses to those and working them into this training as we go. So as we think about MI in non-traditional settings, we need to think about what it is that we're trying to do with motivational interviewing, and then think about how we apply that into those other settings outside of a traditional therapeutic environment. So our goal with MI is really to allow our patients to explore behaviors and possible reasons for concern. So are these behaviors that are working? Are they behaviors that aren't working? What I find more often is that they're behaviors that used to work at one point, but have stopped working more recently. And so we want to get people to think about what those behaviors are and why those behaviors could be reasons for concern. We also need to focus on building trust and empathy while we're establishing rapport so that we can find a way in to the topic of concern. And, you know, when I'm thinking about applying MI in a really, really traditional setting, right, before I'm using motivational interviewing, that relationship has already been established in my office in a traditional clinical setting. But think about, you know, how a primary care doctor might have to build that trust and empathy in a very short period of time. Think about an ER nurse, how they might need to build that trust and empathy and establish rapport in a single visit. Does telehealth change the way you build trust and empathy in any ways? These are important questions that we need to be thinking about and asking. A lot of the traditional ability to build those relationships over time is not as easy to do in a healthcare setting or in a telehealth setting. And I can tell you, you know, we have outreach workers that are able to build this trust and empathy doing street-based social work. So if we can do it there, you can do this anywhere. You just have to think about it a little bit differently and think about how you might build those relationships more quickly or focus on specific aspects of those relationships. And then once we, you know, have identified those behaviors, once we've built that rapport and empathy, we next want to move into evaluating how people feel about their behaviors and whether they have any concerns. You know, I've seen some really cool applications of MI in the healthcare field. I wish I could see it. I wish I saw it more, but it is happening. I remember going to my own PCP a couple of years ago. It was the first appointment, and you know, she was reviewing my vital signs and my weight. You know, looked at my BMI and said, you know, your BMI, it's okay. It's not where it could be. You probably given all the other things you've got going on in your life, you probably don't want to think a lot about weight loss, but what would it take for you to commit to losing, say, 5 pounds? And I'm like, oh man, that's motivational interviewing. I know what you just did. Way to go, doc. That was a great question to ask about evaluating my feelings as the patient about my weight and whether I had any concerns. So I've personally seen this be applied in healthcare settings, and I can tell you that it works. I think about my last doctor, and my before that was like, hey, your blood sugar is a little bit high. Maybe you need to eat a few less sweets and a few less sweet desserts. I can tell you right now that if your blood sugar doesn't get under control, you're at risk of pre-diabetes, and then you're going to be insulin, blah, 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 blah. I tuned it out because this doctor was basically using scare tactics, and that wasn't engaging me. I'm like, I'm young, I'm healthy, I don't got anything to worry about, right? And there were two different approaches that these doctors took towards helping me commit to the change process. And I have to say, the one that used motivational interviewing definitely got me thinking in a very different way about maybe losing a couple pounds. All right. So some other things to think about as we start applying that MI to non-traditional settings. If it's appropriate, you can always give some information, but more importantly than giving information when it comes to MI is asking people for their thoughts about that info. When we do nothing other than providing information, we run a risk of that information being interpreted as authority or that information being interpreted as explaining. I see this a lot in the recovery world, where people that have navigated their own personal recovery have their own recovery journeys that have worked for them and want to share those experiences with other people, but do it in a way that minimizes that autonomy for folks. So I see this a lot in individuals that have used AA as part of their recovery model and as part of their recovery process. AA is amazing and it works really well. And if it didn't work, there wouldn't be a meeting happening right now in some church basement somewhere in the town that you're zooming in from, right? AA works. The problem with AA is that it doesn't work for everyone. And so I see folks say, oh, you should go to an AA meeting. Do you want to talk about the 12 steps, things like that? And those are great questions. And that's great information. But if we're not taking the time to check in with the folks about how they feel about getting that info, they tune it out a lot. And they will stop listening and feel like you're trying to tell them what to do. So the way I might phrase that would be, oh, have you ever heard of AA? What do you think about AA? What have you heard? What do you know? And so I'm providing that little bit of information, but more importantly, I'm asking for people to give me feedback about how they receive that information. And that is critical for enhancing motivation and moving people through the change process. Another thing that you can do in any setting, it doesn't matter where you are, is ask people about next steps. So what do you think you'll do next? What will you do? How do you feel about that information? Or as my doctor said, can you commit to losing 5 pounds, right? These are things that are really, really important in those non-traditional settings, is to get people to commit to next steps. Even if that next step is meeting with you for a second time, getting them to commit to that next step is important. One of the critical pieces of MI is keeping the door open for the next time, right? We don't have to move somebody from pre-contemplation to maintenance or long-term change in the first time we meet them, right? The patient doesn't need to agree to change for that session to be successful. Simply discussing concerns increases that motivation to change. And this is a process that happens over time. It doesn't have to happen the first time. It doesn't have to, people don't have to get it right the first time. In fact, over the years, Miller and Rolnick, who are the folks that developed motivational interviewing, have moved away from stages of change. And you'll notice that I'm not going to be talking a whole lot about stages of change, because one of the things that they found that was happening was that practitioners were so concerned about people moving through the stages of change that they started getting authoritative, they started explaining, and they realized, wait a minute, yes, understanding this model and understanding the stages of change is important to motivational interviewing, but motivational interviewing isn't about change. It's about enhancing the change process. And so they've actually, by the third edition of motivational interviewing, they had taken a serious step back from stages of change, because when we as practitioners get too focused on stages of change, we get less good at motivational interviewing, which is about increasing that motivation to change. So always remember that a person doesn't need to agree to change in order for the session to be successful. We just need to help them increase their motivation to change. And that sometimes happens over time and takes a little bit longer. I want to jump into my favorite component of motivational interviewing, which is evoking. And this is that process that helps elicit that change talk, get people thinking about what change means to them, what their own internal motivation for change is, and how to develop their own strategies for moving that change forward. So a couple of the tools and techniques that we can use in the evoking process are elaborating. So saying things like, oh, can you tell me more about that? What does that mean to you? What does change look like to you? How can you be successful in changing? We can ask evocative questions. So why is that important to you is moving into that place of asking evocative questions. Are there folks in your life who want you to change? What do they want from you? How does that make you feel? These are the types of evocative questions that are so helpful in motivational interviewing. Using the motivation ruler, that traditional technique in MI, fits very squarely in the evoking section. And we're going to talk more about that in a few minutes. I won't go into too much detail right now. Another potential option for the evoking process is querying extremes. So this is that, what's the best thing that's happened to you? Or what's the best possible outcome if you continue this behavior? What's the worst possible outcome that could happen if you continue this behavior? You're really getting people to think about the best case scenario and the worst case scenario. And that's great, but it also misses some key facts some key components that can enhance or inhibit the change process. And that's why I like a tool called decisional balance, or the four-way window, a little bit better than querying extremes. Because when we're querying extremes, we're usually asking, what's the best thing that can happen if you change? What's the worst thing that can happen if you stay the same? Right? And that's great, but there are other components, there are other factors that go into making that decision-making process that get missed when you do best and worst, because there are reasons why people haven't changed yet. And the decisional balance looks at the pros and cons of changing and the pros and cons of staying the same, right? So I may ask somebody, what are the benefits to changing, but what are the costs to changing, right? People are afraid of change. There's this old saying in the recovery field that people don't change until the pain of changing people don't change until the pain of staying the same exceeds the pain of changing, right? Change hurts, it's scary, it's frightening, it's new, it's different. we need to think about why people aren't changing, what's keeping them kind of stuck where they are. And exploring that decisional balance is one of those really, really, really effective tools for getting that complete full picture, which is why I call it the four-way window. It's 4 ways to look into a person's life and see those real reasons why they may want to change, but why they may be kind of stuck where they are as well. Another technique you can use when you're evoking is looking back. So this is something that is, when we understand, particularly in the recovery world, that people are, that people engage in behaviors that aren't working now. At one point, those behaviors probably did work and they accomplished a goal for a person. And so looking back helps to really think about, when was the last time that that behavior really and truly worked for me and accomplished the goal I wanted to accomplish without any collateral damage. And getting people to think back to when that place was in their life helps them think about how much their life has changed since then. And it's a really effective tool for getting people to acknowledge that things did work in the past, but maybe are less effective now than it was before. Another possible option would be exploring goals and values. This is that, where do you see yourself in 5 years question? Where do you see yourself in 1 year? How does your current behavior support or get in the way of you living up to your values and upholding your values? This is something that is a great tool for people that are really future oriented. I don't use it as much because I found with folks experiencing homelessness, people tend to be really kind of stuck in the moment and actually getting people kind of future oriented can be kind of triggering sometimes. So I tend to shy away from this one, but it is a valuable tool and an effective one with somebody that is really future oriented and thinking about their goals in the future. All right, any questions so far on any of this? I'll give everyone a few minutes. We can raise hands or throw things in the chat. Nope, good, okay, all right. So what I'd like to do now is spend a few minutes really diving into these tools, whether it's the readiness ruler or the 4-way window. So what I'd like to do for a couple of these role plays is take a volunteer. And what I'd like is for I think setting this activity up for something that is very prevalent these days and something that exists kind of in the world of telehealth and all other healthcare these days is vaccine hesitancy and vaccine resistance. This is a key area where I think we can all be using motivational interviewing regardless of our profession. Do I have anyone that is willing to volunteer to role play a vaccine hesitant or vaccine resistant patient? Maybe you've had some experience with this already. Maybe you've worked through someone, and I'm going to walk you through how we can use the readiness ruler to increase their motivation to get vaccinated. So do I have a volunteer? And you can unmute your mic if you would. That would be really helpful.
I can volunteer. This is Lillian Nieves.
Lillian, thank you very much. I appreciate it. What I'm going to do is walk you through the readiness ruler and how to use the readiness ruler to enhance the 3 components of change. And I believe that worksheets were sent out ahead of time, and there's a better visual form for the readiness ruler that I sent out to everyone if they want to look along. But I wanted to get all this on one slide to make this activity a little bit easier. So feel free to look at the slides or the readiness ruler. So Lillian, how are you doing today?
I'm doing great. How about you?
Good, 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 good. So so we have a clinic coming up where we're going to be able to provide some COVID-19 vaccines, and I just wanted to know if I could get you signed up for that.
Ooh, I don't know about that. I really do not want to get the vaccine. You have the J&J vaccine, I heard, and I'm really scared.
Okay. All right. So you're really scared. I can definitely hear that. And can I ask you a few more questions and get to know a little bit more about why that makes you so scared?
Yeah, of course.
Okay. So oh, my bad. So, on a scale of 1 to 10, with 1 being I am completely not ready to get a vaccine, to 10 where I will sign up for the vaccine at the end of the day today. Where would you rate yourself on that scale between 1 and 10 of your readiness to get vaccinated?
I would say how ready am I to get vaccinated today? I would say a 3.
A 3. Okay. So 3, why did you choose a 3 instead of like a 1?
Because I'm thinking about it, but I'm waiting for other people to do it to see how they react.
Okay. So you're thinking about it. You're not completely opposed, but you're not completely ready yet either. So what would it take for you to go from a 3 to like a 5, which would be midway?
That's a great question. Maybe learning a little bit more about your experience with other patients.
All right. Okay. So I'm going to break character for a quick minute. Thank you, Lillian. So you said that was a great question. What got you thinking? What were you thinking about when I asked that question?
I really had to shift my mindset instead of no, I'm not getting it at all to okay, what would it take for me to make this change?
Mm-hmm.
So it was really a shift in mindset on how I was really negative about not getting it and how, well, maybe if this happened, maybe I could change my mind today.
Excellent. And I think, that's a key piece of this readiness ruler is that it's not just about, it's not just about where people are at on the readiness ruler. It's asking some additional follow-up questions like, why not this really low number? And then what would it take to get you to move a little bit higher? And notice I said, what would it take to get you to a 5, right? Not what would it take to get you to a 10, because we don't want to set unrealistic goals for folks. And based on your response, right, I now have some information that I can use to help get you to that 5. I may be able to provide you some research on the safety of the vaccines. I may be able to get you some feedback from other clients or other patients that have had the vaccine. Now I've got some tools that I can use to further enhance that motivation. All right, Lillian, I'm going to get back into character here. Okay, so we talked about your readiness to get the vaccine. On a scale of 1 to 10, how important is it for you to get vaccinated?
I would say a 5.
Okay, so you said that the 5 right in the middle, and interestingly, you were able to identify that getting the vaccine was much more important for you than you were ready to get the vaccine. So why did you choose that 5 instead of a 2 or a 3, as far as importance goes?
Because I do want to get the vaccine, but I think it's too early for me to make that decision.
Okay. All right. So getting a little bit more information, having a little more time in might make the vaccine feel more important. So tell me more about why you'd like to have a little bit more time and get a little more information.
Because I think that the FDA approved the vaccine for emergency use too quickly, and I don't think that the studies were really safe. I hear a lot of bad things on the news, and I think if I stay home and follow what they tell me to do, I would be fine. I've been fine so far. So what is it to wait a little bit longer?
Okay, so you've been a year, right? And what's another couple weeks or another couple months while you're making sure that you're hearing that this is a safe vaccine? I can totally understand that. But thinking about the importance of getting vaccinated, what would it take for you to go from a 5 to a 7?
I think that knowing that it's not just an emergency approval, but a real approval.
Okay, so you think that and I'm hearing in the news, right, that Pfizer, I believe, is actually seeking the approval, not just the emergency authorization. So is that something that you feel like once that happens, it might be a better time for you to schedule this appointment?
Yeah, I think so.
Okay, all right. And lastly, on a scale of 1 to 10, how confident are you that you can get the vaccine when you're ready?
I'm confident that I'll get it when I'm ready.
Okay.
There's plenty of appointments available.
Okay. So you see no problem in getting the actual vaccine once you're ready.
Yes.
Perfect. All right. Well, thank you very much, Lillian. That was a great role play. Very realistic, and this is the readiness ruler is something that we can use kind of anytime, anywhere, and it's something that can be used for as something as simple as a vaccine. The whole idea with the readiness ruler is that we're not focusing on a single aspect of the change process, but we're focusing on the readiness, the importance, and the confidence. And we are not just kind of rating where people are at, we're anchoring that scale with why they are more ready than they think they are, and then asking some really big questions about what it would take to get them more ready. Not what would it take for them, not what would it take to get them to make that change, but to get them more ready to make that change. And that's really important. And this is a situation where I may throw in some things like, hey, did you know that the CDC has said that people don't need, if people are fully vaccinated and they're exposed to someone that has COVID, they don't need to quarantine? Because I heard you say that you could just stay home and you'd been here, for a couple months already, and what was a couple more weeks or a couple months. I may add in some information that might help kind of increase that importance, right? Like if someone in my household gets COVID and I'm fully vaccinated, I don't have to stay home. I don't have to isolate or quarantine for 2 weeks. Maybe that's something that increases the importance for folks.
Bill, there's a good question in the chat. Is there a number on the ruler that is so low that you would shift the topic you were asking about?
So I think that, interestingly enough, with the readiness ruler, I don't see a ton of 1s or 10s, but what I do see occasionally is people that are incredibly low in one area, but not incredibly low in the other two. So if somebody says that they're at a 1 all along on every single one of these components, I may look at realizing that this isn't the right time or place for this person to make that change. I would focus pretty much exclusively on harm reduction techniques at that point, basically keeping the person kind of safe until we can kind of move that change process forward a little bit more. I may take some steps back. I may use a different tool in that situation. More often than not, what happens is we find out that one of these areas scores significantly lower than the other two. When that happens, then I'm focused specifically on improving readiness, importance, or confidence, depending on what category scored the lowest. I think that's where using the full readiness ruler and covering all three of these components is so helpful, is that, you know, if you only ask them how ready they are, how important it is, or how confident they are can change, and you get that score of 1 or 0, right? The inclination is to say, uh-oh, you know, maybe this is something that we shouldn't be working on and we should be working on something else. And that's kind of like throwing out the baby with the bathwater, because if you kind of got unlucky and asked the wrong question first, and somebody said they're not ready, it's not important, or they're not confident at all, it's a 0 or 1. I think that, you know, that usually people score higher in other areas. And so when you ask all three, you get a better chance to find that one area that is significantly lower and really, really, really working on that. You know, if somebody says that it's an important at an 8 and they're ready at a 5, but they're confident at a 1, I think it's even more important that we spend time working on that area, because they've got one component that's really holding them back when they might otherwise be really successful. And so I'm going to spend a lot, rather than avoiding, I'm going to spend a lot more time working on that one component or that one factor.
I do have a question. I think the harm reduction techniques is useful, but wouldn't that be considered a little bit of scare tactics? I'm wondering if maybe we should ask the patient, what would you like to discuss?
Sure.
And maybe give them a choice of, you know, 2 or 3 things that may align with what it is that you were planning to discuss. Mm-hmm. Like, you know, for me, I do a lot of diabetes, so I'm like, okay, would you like to talk about A, B, or C, or mm-hmm. D? And then that, I think, has helped me, instead of just saying, oh, you're gonna end up getting kidney dialysis, or you're gonna need a transplant, like things like that. So that's generally what I do, is I just give them a choice, and I think that generally works well.
Mm-hmm. And yeah, and when I say harm reduction, I mean more safety-based kind of things. And so for this person that's incredibly resistant to, you know, addressing their diabetes, I may just want to make sure that they've got access to testing supplies, and that they know, doing a little bit of education around when your blood sugar is too high or too low and you need to get like medical assistance, rather than focusing on getting them to change their behavior. I may focus on giving them the education and tools they need to stay safe long enough to get to the point where we can get the behavior change. So yeah, again, if they're very much focused on one thing and not diabetes management, then I'm going to go where that's a big part of motivational interviewing, is going where they are, meeting them where they're at, and focusing on a change that you can enhance at that point. Excellent. All right. So do we have another volunteer that wants to walk through a role play on the decisional balance or the 4-way window? And I do realize that we are running a little bit short on time. It is 12:30, and so this is something where I kind of set this up so that if we were a little bit short on time, we could walk people through. I could walk people through how to use this tool if we don't have a volunteer. This is one of my favorites. Nope. All right. So as I mentioned before, when we are working through this decisional balance, we are talking about both the current situation that a person's in and the potential change that we're thinking about getting them to make. And so when we are looking at a current situation, there are benefits to a person staying in that current situation and consequences to them staying in that current situation. If there weren't benefits, they probably would have changed by now, right? But if there weren't consequences, we probably wouldn't be having this conversation about a need to change anyway. When we're talking about a potential change, right, there are obviously benefits to that potential change, but there are also costs that are associated or consequences associated with that potential change. And we want to get people talking about both the benefits and consequences of staying the same and the benefits and consequences about potential change. Once we know what those benefits and consequences are, we can spend more time kind of enhancing the benefit or minimizing the consequences depending on where we are. And we need to understand and know that there are going to be benefits and consequences to staying the same and benefits and consequences to changing. Some of my favorite questions to ask when we're talking about benefits, and I usually start with, when I'm doing this 4-way window, I usually start with the current situation because that's where people are at right now. And so I get them focused on the present and the here and now, and then I work on what does the future look like. So some of the questions for the benefits of the current situation, what are some of the good things that will come from not making this change? How will staying the same benefit you? What is currently working, right? We find the things that are keeping the person kind of stuck where they are or preventing that change process, because there usually are some benefits. A lot of times, these are benefits that have happened in the past. And so this is a really good time to kind of dovetail some of those looking back pieces. So somebody says, oh, well, my alcohol use really helps me cope with anxiety. We may say, okay, so tell me a little bit more about that. What does that coping with anxiety look like? Has alcohol's ability to help you cope with anxiety changed over time? And really dig into those benefits a little bit more. When we're thinking about consequences, this one is usually a little bit easier for folks to come up with. Otherwise, we wouldn't be talking about a change to begin with. And so we would say, what are some of the negative things associated with staying the same? What's currently not working with you? What are the costs associated with not changing or not staying the same? And usually people don't have as much trouble kind of filling out this box. This is one of the ones that ends up being a little bit longer because folks, are kind of, this is one of those places where people are used to thinking about the consequences. People don't always spend as much time thinking about the benefits of staying the same or how it helps them. Then we move into the potential change box. And so I might ask things like, what are some of the good things that will come from making this change? How will making the change benefit you? Right? And again, this is another one of those areas where it's usually a little bit easier for folks because they've been thinking about the consequences staying the same and the positives of changing. So those two boxes, usually people get fairly easily without a whole lot of thought, without a whole lot of sweat. Then you get to the consequences of potential change. And this to me is the box where most of the best work happens because no one ever stopped to ask people about the risks or the costs of changing, right? Everyone talks about the benefits of changing, but no one ever gets people talking about their fear or anxiety about change. And if something is going to really bring out that evocative moment in people, this is the box that you're going to do that in. This is like, people will stop and like have this aha moment when you get to this box and realize that they are afraid or they are anxious and they hadn't thought about that. And that they're realizing that anxiety or fear or worry is really, really, really impacting their change process. And so some of the questions I might ask are, what are some of the negative things associated with changing? What are you worried about related to this change? And what are some of the costs associated with those changes? And this is when you have this 4-way window or decisional balance worksheet completed, it gives people that really, really, really complete picture of the change process and the decision-making process that's associated with it. And when I'm doing this with folks, I like to do this on paper and give them that paper and have them fold it up and put it in their pocket and take it with them. I think that having that kind of tactile, tangible kind of connection with their answers to these can be really, really helpful, and helps kind of bring that change out of the traditional therapeutic setting and more into their lives. Actually, as we wrap up, I'm going to give you 5 simple questions that you can take with you to do motivational interviewing anywhere. Why would you want to make this change? How might you go about it to succeed? What are the 3 best reasons for you to do it? How important is it for you to make this change and why? And lastly, so what do you think you'll do? And those are 5 easy, simple questions that you can use for motivational interviewing anywhere, any place, anytime, including over the phone, at Friendly's, in the emergency room, or one of my favorite places, on street outreach.